At Dentures and Dental Services, we are committed to providing quality dentistry from a caring staff, all at an affordable price. At Dentures and Dental Services, we understand the anxiety and frustration that can be associated with dentures. We all understand dentures are the last or best option you might have. That being said, dentures can improve your life. We also understand that no one enjoys going to the dentist, but everyone enjoys a beautiful smile and teeth that function properly. We work to make sure you feel confident with your decisions and understand the procedures we provide. We will provide you with all the information you need to make a good decision and also answer any questions you might have. Remember, everything that we tell you now is information. Everything we tell you after your surgery will seem to be excuses. So we want you to be as informed as best we can. First, we want you to understand the problems and risks that go along with extractions. Like any surgery, there is risk involved. When a tooth is extracted, it is possible to break off root tips. When that occurs, it is sometimes better to leave them instead of trying to dig them out of your bone, which will allow the tips time to work their way up to the surface for a more simple removal. There will also be bone fragments or chips that will be coming out for some time after your surgery, which is very normal. You can also have nerve damage and sinus exposure. These are just a few of the risks, along with the others listed on the extraction consent form that you will be signing. We encourage you to carefully read that form. Now, I'm going to walk you through a general overview of what to expect with immediate dentures. This will help to clarify the process for fitting new dentures and establish a general expectation for the fit, feel, and appearance. Dentures are a replacement for what God gave you, the same as an artificial leg or an arm. Dentures are not fun, and it takes patience and determination on your part to make it all work. It is a learned process that requires motor skills. Your healing period can be very frustrating. Learning how to eat and talk with your new dentures and dealing with having something extra in your mouth that you're not used to. A common question we hear is, how will they fit? To answer this, you need to be familiar with the process. When a patient's teeth are extracted, the gums and the jawbone will begin to heal and shrink, causing the size and shape to change. At first, your dentures will not fit well, but the process has only just begun. After about 2 weeks, the denture will begin to fit more loosely, which is due to the changing jawbone. This is when you will return to the clinic to your first of a series of soft liners. The soft liner will fill in the voided areas or gaps and help the denture fit and feel better. At this time, you may also need adjustments to help your denture fit and function better. You can call us anytime you are having problems and need help. You don't have to wait until your next scheduled appointment. Remember, we are here to help you through this healing process. The healing process can last from 8 to 10 months and will result in a permanent change of the size and shape of your jawbone. It is important you understand that the immediate soft liner package you will need to plan to see us frequently for soft liners and adjustments as they are required. If drive time or having a ride is an issue, you need to give that some thought and make the right decision for your situation. After you've healed, you will receive your permanent hard reline, and then your denture should fit and function properly. At Dentures and Dental Services, we strive to satisfy our patients and are here to help. Generally, most patients are successful with the top denture. Not everyone, but most patients will get a denture seal or a little vacuum to help hold the upper denture in place so that it can function properly. On the other hand, most of the time, the lower denture is a problem because of the tongue and muscles attached to your tongue, along with the constant movement from your lower jawbone. The lower denture is proven to be more challenging, and it can be miserable for you. You should know that it will move around and it is difficult to eat with. But our experienced staff will work hard to make the placement of your dentures as comfortable a fit and as functional as possible. We want you to be as satisfied with your denture as we can help you to be. Now that you have a general idea about how your dentures will be fitted to you, let's move on to the next common question. How will they look? Like the fit process, the cosmetic appearance of dentures will go hand in hand with the healing process. At Dentures and Dental Services, it is imperative to us that your dentures not only function properly, but that they also meet your expectations for appearance. We want you to have a beautiful smile. Your telling others how happy you are is the best advertisement we can have, and we want you to be satisfied with your new smile. That said, keep in mind that your immediate denture is not always what you want it to be. It can be bulky or large, and the teeth may not be exactly how you want them to look. Always keep in mind that we can change or fix things after you have healed. The biggest factor taken into consideration is space. The denture must fit between the upper jawbone and your upper lip. When your teeth are extracted and then replaced with the denture, the sensation will feel somewhat fuller than your natural teeth. It may take some getting used to, but remember, your jawbone will shrink and change. It is a process, and be assured it will get better. An immediate denture is not perfect, and do not expect a perfect smile to start your journey with. After you have healed, we can move the flange of the denture back, reducing fullness for a better look and feel. Again, after you heal, we can make any changes we need to at that time. In our 25+ years of experience, we have learned a lot about our patients and their expectations. We want every patient to know that this is a journey and not an event. You will encounter some challenges and frustration, but remember, it's a learning process. It takes time. At Dentures and Dental Services, we make sure each patient's questions are answered completely before we begin. We want you to be comfortable with every step of the procedure and know that we are here to help you. If at any time you have questions unanswered or you have any problems you are not happy with, visit with our office manager. They are here to ensure that your journey is as pleasant as we can make it. At Dentures and Dental Services, we have made it our goal and mission to get you back to enjoying a beautiful smile and teeth that function properly.